Ladies and gentlemen, you are now tuned into the hottest podcast on the internet, All Raw Opinions. Come on. Norma, I see you. Rollo. All Raw Opinions. Let's talk about it. Let's talk about it.
Welcome, everybody, to Raw Opinions, episode number 3.
3, Norma.
We made it. Yes.
We made it.
Oh, my gosh. We're here.
Can you believe it?
I know. Guess what?
What?
You want to tell everybody who we have here?
We have a doctor in the house.
Whoop.
We have a doctor?
Yeah.
Where's the doctor?
Well, he says he's a doctor. No.
No, he
I play one on
is.
TV.
Awesome.
Dr.P, welcome.
Thank you very much. I really appreciate you inviting me. I'm really honored and humbled to be your first official guest.
Yes.
I don't know how
First
that
official
happened.
guest.
That's
Yep, our
crazy.
first- yes.
Thank you.
Yeah. And by the way, we have a doctor on, but please consult your doctor. Don't take any advice
Yes.
from
For
this
sure.
show today. Consult your doctor
Yes.
first.
Yes.
But these are going to be some good stories.
Oh, yeah. Dr. P, we are honored to have you.
Well, thank you. I appreciate it. I really appreciate the invitation.
So you are a high-risk pregnancy doctor.
I am. Yes. I've been working for about 15 years as high risk.
Wow. That's a lot of schooling.
Yeah, I tell my kids it took about 27 years of school to get to this point. So
Wow.
It is probably way too much. Overeducated and overqualified and don't know how to do anything else.
It takes a special person to do that, because honestly, I hated school.
Special is yes, special.
How did you do it?
Honestly, just that's the only thing I knew that I wanted to do from the very beginning. So it was just not knowing any other alternatives, not knowing what else I could possibly do. So it was just that was the goal, and it just took 27 years to get there. That's
Wow.
it.
Does that come is it like a family type of thing? Is there
Yeah.
doctors in your family?
So pretty much everybody in my family is doctors. Like all my aunts, all my uncles, both my
wow.
parents are doctors. So when I was little and growing up and people would ask me, what do you want to do? I would be like, doctor, because
That's
I
what you
didn't
knew.
know there was
Yeah.
anything else.
Right.
You
I
didn't
didn't
know
know there was
anything
any
else.
other field. So as I grew up and kind of discovered that there were other professions, by that point it was kind of too late. So
You're like,
I was
screw
gonna, Yeah, I'm committed already. I've been
Yeah.
saying this for 10 years, so I might as well do it.
Wow.
But not might as well do it. I actually like what I do. And it was at a certain point, it was I set a goal for myself and I decided this is what I'm going to do no matter what. I'm going to break it. I'm going to make it. And that's it.
Well, it's definitely an awesome career, man. I think what you do is really cool. And actually tell the listeners exactly what you do. We know you're a doctor. We know you high risk pregnancy, but exactly what is that?
So originally trained as OBGYN, which is pregnancy and gynecology, but then subspecialized into high risk pregnancy. So just dealing with pregnancies now that are complicated with either diabetes or high blood pressure, twins, triplets, abnormalities. If there's something wrong with the baby, that's pretty much me.
So you're the person who kind of determines hey, this is your child's going to have, could have this type of issue, or it's going to,
Yeah, unfortunately, I'm the one who delivers the bad news a lot of times. Yes.
How do you handle that? How do you handle giving the families, let's say you're doing an ultrasound, right? And the parents are there and, of course, everybody gets nervous during that time of an ultrasound, right? They just want 10 toes, 10 fingers, beautiful heart, fluttering. And how do you give that news when something's wrong?
It's really hard. I mean, just honestly, I realized that after all these years of doing it, it has not gotten any easier because you recognize that person, for them, that's one of the most important moments of their life. And you're going to be the face and the person delivering bad news and telling them there's something wrong. So it really is hard, but for better or worse, and not to pat myself on the back, but at some point I realized that I do it pretty well, and I do it with a lot of compassion, and it's still, and I think part of it is because it's still impacts me. I still feel it. I still feel really bad for them. Like I could have seen something like that 20 times in the last year, but like every time I have to deliver bad news, it's still hard, and I still feel for them. So I think having that personal touch and just empathy,
that you need.
Genuine empathy is really important.
It definitely takes somebody with passion to do a job like that. And I admire you for that. I really respect you for that. That's awesome.
That's hard to do. You obviously have a great bedside manner, because that's my first thing. If I go to the doctor, if I had any doctor, especially an OBGYN or high risk pregnancy, you want to make sure that they have that bedside manner. If they don't, I'm going to fire them first thing. I'm going to be like, I don't feel comfortable. You're either going to go do a vaginal ultrasound or you're doing a over the belly ultrasound, right? I mean, I don't want anybody down there in my business if I don't feel comfortable, right?
And it's funny that you mentioned it, because I mention this to my patients a lot. I tell them, like, for obstetrics during the pregnancy and for pediatrics, you want to make sure you're comfortable with your doctor.
Absolutely.
You want to make sure that you have a good rapport, that you feel comfortable with them, that you trust them. They could be the most brilliant person in the world, but if the interaction is just lacking, if you don't trust them, if something's off, switch.
Absolutely.
I mean, especially for pediatricians, they're taking care of your most precious commodity. So if it's a bad interaction, if it's a bad relationship, you're never going to trust them completely. So switch. So yes, I agree with you completely.
Yeah. And I can see that you have that compassion, but again, it's not easy to give bad news, but when you give good news, I mean, I'm good sure news. That, I mean, everyone's happy in the room, and
those are the days you probably like the most, when you can give some good news, you know?
I think it's a bittersweet.
It's a bittersweet job.
It's a bittersweet job. Absolutely.
And I've had patients who, at the end of the pregnancy, they tell me, like, the first couple of times we saw you, called you Dr. Doom, because like, the first visit, you have to tell them, like, this is what's wrong, and this is like all the things that can go wrong. So it's a very like doom and gloom kind of conversation. But then in subsequent appointments, I'm like, I don't want to beat you over the head with all the bad stuff.
But you have to be honest.
You have to be honest, but at a certain point, like, you don't want them to dread coming back to you. So you want to like find some reassurance, find some comfort. So they're like, okay, we really didn't like you in the beginning, but then like you kind of grew on us. I'm like, and that means a lot to me. And I'm like, if I'm giving somebody really bad news, but they actually, like, at the end of it all, still appreciate me and like me, like, that says a lot.
Oh yeah, absolutely. And that's why I said it's bittersweet, and then you get your rewarding days, and your days are just like, oh man, like,
definitely.
You know what? I had a question too, because I always wondered, like, how does a doctor choose a field though? Do you like just, because you start the med school, and then how do you get into your specialty? How does that happen?
So it's funny, because I mean, I've watched people go through medical school, and a lot of people from a medical school class, I've seen what happened to them, and I kind of like track them incidentally. And a lot of people go in with an idea of like, this is what they want to do. Some people just drop out through medical school, because once they get that exposure, they're like, no, this is not for me. I want to be a doctor, and they like the idea of being a doctor. But from a practical standpoint, when it comes to like actually doing it, they're like, this is not for me.
It's overwhelming.
Right. And then in the third and fourth year of medical school, you actually get exposed to the major topics like medicine, surgery, pediatrics, OB, things like that. So at that point, a lot of people get exposed to fields that they never really entertained before, never really thought about. So a lot of people kind of switch their fields at that point, or their ideas of what they actually want to do. And that's when it really happens, like towards the end of the medical school. And unfortunately, sometimes like they finish the medical school, they get into their field, and a year or two into it, residency, which is kind of like training, which could be like 3 to 4 years. Some people figure out that they don't want to do that at that point, and they have to kind of make a lateral move, except they have to go backwards. And so,
Is there OBs in your family? OBGYNs?
My mom's an OB.
Oh, nice.
She's mostly, it's funny because she never liked OB. She never liked pregnancy. She liked GYN. She liked the surgery and GYN.
The surgery.
And I'm completely opposite from that. But I think I was inspired by her to go into this field because I saw like all the pictures that patients would send her, and like I saw the love and the appreciation, and like I think that kind of like drew me to that field.
Oh, that's sweet. I mean, you had that bond with your mom probably too.
Yeah.
Well, luckily they weren't proctologists. I don't know if I'd want to go in that field. I think I would take the route you took. But then again,
I wouldn't blame you.
But then again, anyways, go ahead, Norman.
Oh my gosh. But I do have a question for you. So doing your residency on all that, you've probably had to like do all the pap smears, all the deliveries, all of the, all that growy stuff that you don't want to like.
Yes.
How was that? How was that experience of doing pap smears?
I've seen a lot of vaginas.
I saw a lot of vaginas. And like the old joke is like, people would talk like when I was starting training, it's like, you saw more vaginas than I will see in my entire life. I'm like, if you've seen 100, you've seen way too many. That's God bless, but that's not like, I'm sure like when you talk to dentists, like the last thing they want to do is look in your mouth again. Like it just like, stop.
Okay, I have a question.
Yeah.
Did you ever run into any smelly ones? Their pH was
now we're getting into it.
Yes. By definition, gynecology is.
So I know, but I mean, obviously their pH is off.
Yeah, there's a lot of things that can be off. If smelly was the worst thing that I encountered, that would be a good day. I mean, I could tell you stories that would curl your toes.
Oh,
my gosh.
Yeah.
Jesus.
I have a question.
Yeah.
Please, Norman, because if I ask, it's gonna sound weird.
Did you do pap smears?
Yes.
Okay, so
it's been a while, but yes.
So
wait, hold on. For can I speak for the guys really quick? Besides the doctor who's a male. Yes. What the hell is a pap smear? Okay, explain to me that.
A pap smear is a woman's
sounds like a beer.
It's an annual physical exam where she has to make sure that she gets checked down there for any cervical cancer, any like cyst, anything that can go wrong in their cervical area.
Right.
So basically every year, now they changed it, but when I was training, every year a woman would have to come in and I would put a cold metal speculum, which is like
it looked like
spoons,
a duck.
which like opens up your vagina like a cave.
Jesus.
Yeah.
And at that point, and I'm aging myself, at that point there was a little wooden spatula that I would
scrape.
Put in the cervix and scrape it around. Now they do it completely different. Now
Does
it's like every 5 years. It's not the most pleasant thing.
No, it's not the most pleasant thing, but
damn.
Imagine going to a proctologist and they go, well, I'm not going to use one finger. I'm going to use 4 fingers today.
Yeah.
Ouch.
Yes.
Yeah, no thanks.
Yeah, we've had women have to go through a lot, but I had a question in regards.
I'm so sorry for you guys. I'm sorry.
Oh God,
really? God bless women.
Hey, you feel sorry, but you don't feel sorry when you're going in there, huh?
No, I'm actually feeling very enjoyable.
That's when he appreciates the doctors because they keep it clean.
Yeah.
I know.
Or women keep it clean.
Yes. But I had a question. While doing a pap smear, has any woman ever farted?
Again, these questions are not scripted. I didn't know Norma was going to ask this.
So I have to ask because I've been in that position. I've been in that position.
Were you farted?
No. In that position because you're just sometimes you're sitting there and everything's open.
But that's your fear, right? That's your fear that you're going to fart.
No.
Has that never happened? All of your whole years?
I cannot recall. I would think that I would remember that, but I get the fear because when, as a guy, like I get, my exam, I'm afraid that
you might fart. It is what it is.
It happens.
Yeah.
You know what? Because sometimes the doctors leave us there with like stirrups and we're like, okay, where is he? And he's running around the office doing other things. I'm like, I've been sitting here for 15, 20 minutes or sometimes 30. Yeah, like my HooHaa is like in the fresh air and I'm like, hello, where is he? Right? And then he comes in for 2 seconds and I'm like, that's it? And you left me over here freezing my HooHaa. Like, I'm just asking, like, as anything.
Well, should they give you warm blankets? What would be good?
You're kind of in stirrups and your whole thing is open.
Paper gown.
Jesus.
There's nothing.
There's nothing. We
they
go
leave
through a
you
lot.
wide open.
They leave us wide open.
Yikes.
I know. Well, I don't think anything like that has happened. I don't remember anything like that happening. But I found stuff in there.
Yeah. What did you find? What did you find, Dr.P?
Yes, because I've heard
finding a condom during a routine exam is never fun.
What? Wait. So hold on a second. Dr.P.
Because they stick stuff in there.
Yeah, I know, but hold on. You just said that finding condoms with plural, that means it's happened more than but it's happened more than once. Is what I'm saying.
It has happened.
So it's an actual occurrence sometimes.
Apparently,
Jesus,
is that all you found?
I don't know how people forget a condom in there. I don't know how women don't know they have a condom in there. Maybe they just had sex like right outside in the parking lot, and she just came in for. I don't.
You find any jewelry up there? Any type of like lost keys and shit? What was
I would have kept it. I probably would have kept it.
That's my remote went. God damn it!
But I would have kept it. Yeah.
My TV remote. It's been there. It's been lost for 2 years.
I haven't been able to find it.
Jesus.
Have you ever found anything other than a condom?
Tampons.
Oh my God. Like old ones?
Putting a speculum when there's a tampon in is not pleasant for anybody, most of all a woman. And you would think that like you're shoving something when there's already something there, the woman would like, oh, by the way, I have... No, I have to find out the hard way.
I got a guy question.
Go ahead.
I have a couple actually.
A tampon?
No, not about tampons, but I don't, that's a whole nother world to me. But so how can a woman stay fresh down there? Because as a man, sometimes, I'll just got to put it out there. There's been some times where I'm like, wow, she's a little funky down there. How do you tell a woman, first of all, they're a little
pH
funky?
balance.
Well, first of all, don't tell a woman that. Anything down
you'll
there.
get smacked.
That's how you
You'll
lose
get
a woman.
smacked.
That's okay.
Yes, lesson number one. I mean, honestly, it's about hygiene.
Right.
It really is just, wipe from front to back.
pH balance.
Keep that shit clean. That's it.
Yes.
No douching. Do not douche. I don't know how that trend started.
Yeah, I heard that's bad.
It's a fragile ecosystem.
Yes.
That's what it is. You throw the balance off a little bit and you get...
You're screwed.
You're screwed.
You're screwed.
Yeah. Really?
Yes.
You making cottage cheese in there, and that's not fun for anybody.
God damn.
Yes. Yeah. So it's just good hygiene.
Nasty.
Just like for guys, you have to take care of your penis, right?
Yeah.
You
Of course,
have to
of course.
clean. Exactly. Of course. Like you don't want to put like betadine on it or like alcohol or anything. Just like regular, water clean. Just that's it.
Yes.
Nothing in there. Don't
stick nothing up in there.
Ladies, do not stick nothing in there.
Do not douche.
Unless it's me.
Yeah.
Oh my God.
Well, that's how you get it dirty for sure. That is for sure.
I'm very clean, actually.
Dr. P.
I'm very clean.
Okay, we're not talking about that.
That's not. Yeah, we have it's a gynecologist, not a penistologist.
Yeah, we're not. Oh my God.
A urologist. Urologist.
Oh my gosh.
Yes.
Urologist.
Yeah.
Yes.
Urologist.
Didn't you have a question for Dr. P?
I got a lot of questions for Dr. P.
Okay, you had a good one.
Lay it on.
Okay, so you were able to do the women questions right now. So I have a couple questions. Not that I feel like I am an expert in the vagina, but since we have somebody who knows a lot of the birth canal and the innards of a vagina.
Innards. That's how we call them. Innards. Yeah.
Okay, for us men out there, ladies, go ahead and tune out. Men, where exactly is the G spot? I feel like I know where it's at, but can you give us like a GPS map where it's exactly
my friend,
every time?
If you have not found it by now, it's way too late. It's way too late.
I can't.
You just.
I mean, is there like an address where I could put in my phone?
Yeah, you can Google it.
Google it. Like give me
Google
walking
Maps.
distance.
It's too late for you.
Yeah, it's too late.
Man, I have not had any complaints, by the way. Anyways,
I pity the women that you just experiment on, and like it must be like an ordeal for like 10 minutes. Like, is it here? Is it here? Is it there? Is it there?
But is it so? It is different on every woman then, or is there an actual?
It is
button
a little
that says
different.
This is it?
By a slight, right?
It's a little different. There is a cluster of sensory neurons.
Here we go. Listen, males.
At the roof of the vagina, and it's about a couple of inches in, like a little bit before the cervix. But here's the thing, and this is my personal opinion. This is not a medical fact.
Exactly.
So, some people say there's no G-spot, there is G-spot. I really do believe that it is how a woman feels about you.
Ooh.
If she is into you, it doesn't take much to get her off.
Yes. Absolutely.
Everything's a G-spot.
Everything.
Dr.
And
Vagina
if she's not,
right here.
then you could be like down there like a freaking dwarf miner for 3 hours, finding like chiseling away nothing. You'll never find it.
It's mostly it's the brain connected to the vagina.
And you probably
100%.
don't have chemistry if she has not like squirted
100%.
on your face.
Yes.
You know what? Then you got
that's
no
another
chemistry.
good question.
Then you have no chemistry, boy. Let me tell you.
I'm glad you.
And by the way, it's not all about the guys. Some women just do not have orgasms.
really,
They have just a block. And I don't want to it is a psychological thing.
Yeah.
It's not a crazy thing or anything like that, but some women are not into sex. Some people, women and men are not into arousal, orgasms, or anything. So just because you can't find a G-spot on a woman doesn't mean that it's necessarily you. Doesn't mean that it's
thank
her.
God. Thank God.
Oh my God.
No,
Thank
most
God.
of the time it is you. In your case, most of the time it is you. But
is it
at bare minimum, there has to be a connection. The woman has to feel
Right.
something for
Yes.
you.
Okay.
Yes.
Okay? That's
So no matter how many nerves they got down there, this
no.
ain't gonna happen,
No.
huh?
No, because you know what? If she was into you, all you had to do is probably just whisper in her ear, and she's like,
Yes.
"Bam!"
Right.
Exactly.
Okay, I got another question
Please.
for the men.
Yes.
Now, is it okay? Can a woman actually? Do they release fluids when they
Absolutely.
orgasm? Is that pee? Or is that, I want to know the answer.
I know what you're asking, but yes, there's increased vaginal lubrication.
In a
for
mixture,
sure.
right?
When you're aroused, when a woman is aroused, not you,
Yeah.
but different things happen. When a woman is aroused, there's more vaginal lubrication. So you go in smoother, right? For sure. That's 100%. As far as squirting,
Yes, squirting.
no,
There you go.
that is 100% false. It's actually secreted from a Skene's gland, which holds about 1 milliliter, if that. And there's 2 of them on both sides.
Okay.
So the most a woman can squirt will probably fill in quarter of a thimble cup.
Jeez.
Wow.
So whatever you watch on pornos, when you type in squirters,
Yeah. What is that?
that is piss.
Oh.
That is
Wow.
all piss.
That is
Yeah.
good to know.
Yeah.
That's very good to know.
Wow. Yeah.
I mean, there's just not. There's
This is like
nothing
sex
in there that can
education for him.
produce that much. There's nothing in there that can produce that much fluid.
I got to be honest. I'm not going to ask. Do I ask? I don't really care, to be
How old
honest.
are you in your learning sex education right
Look,
now?
I don't think any guy cares.
I would ask, because if somebody's pissing on me, I would want to know if they do.
Right. But at the same time, a man's going to, if the woman's
The idea
doing her
excites
thing.
you. The idea of somebody.
excites him.
Like,
No, actually,
you're
I'm not.
willing to disregard that
No.
it's piss
I'll be honest.
just because, I'm making a woman.
No,
squirt.
I've actually,
Yeah.
to be honest, I've never had that experience. I'm not going to lie.
Well,
Wow.
That like
good.
shot out like a faucet. No, I've never
But
done
maybe
that.
she didn't have chemistry with you.
Maybe not. Maybe not. But the fact is that
Squirting is a myth. Yes,
It's a myth.
not. Oh, it's for porn. It's not a
all
real
bullshit.
thing. It's
well,
pee.
you heard
You heard it here.
He's excited.
Yes.
He's
Yes.
very excited, Dr. P.
Yes.
it's you
Wow.
come on Raw Opinions, you got the alcohol starts kicking in, But anyways,
Yeah.
we might have to edit that out.
No,
No, we're
this
not.
is raw. We're
This
not.
is- this is real.
No,
This is raw.
real.
Yes.
Yes. Dr. P's answering all your sex education questions. Anything else raw?
Yeah. And it is a little sad that you're asking these questions.
Look,
at your
I'm
age.
asking for the viewers. I'm asking for all the men out there because we don't really
Are you
care.
gonna
I'm
ask
asking
him
for
which
my
finger
friend.
you use? Which finger is the best finger to use to finger her?
Is there a certain finger? I don't. You tell. Is there a certain finger we should use?
I really have not seen anything like that in medical textbooks.
Oh, wow.
That is probably based on personal
on
experience.
personal experience.
Yeah.
Raw's like, I'm just going with my tongue.
Hey, I've never had any complaints, so I'm just saying.
Listen,
that I know of.
all of that is like science. You experiment until you get good at it, right?
Right. Yes. I agree.
But let me
Or-
ask you a question though, Dr. P. Like, is it if you with your profession, you do see a lot of vaginas, you see is it just like now if you saw one, are you just like whatever? Whatever.
It's been whatever for about 15 years.
Oh God, that sucks. That's the bad part of your job, dude.
No, it's not, because you have to have an emotional relationship with that.
Yeah.
I
Right.
love my wife. I love
yes, absolutely.
Oh, of course.
But That is different. That is,
different.
it feels very sterile. It feels very like mechanical. It's just like, and I honestly, not the favorite part of my job. It just, you know, so like I said, if you've seen 100, you've seen way too many.
Like to me, like if some lady was walking around and she's just flashed me her vagina, I'd be like, oh my God, but you'd be like, whatever.
I honestly, like, this is a funny story.
Oh
like,
shit, hell yeah, call take a picture. You'd be like,
yeah, whatever.
I see tomorrow.
I was in, I was in residency, so maybe like my first or second year in, but at that point seen way too many vaginas. Right. And I went to a strip club with my high school friends. They dragged me. I'm like, I'm not into it. I don't. And all of them are just like super glued and they're just throwing dollar bills. And I'm sitting there, I'm like, why am I paying for this?
Why?
I see this every day. This is not interesting.
Exciting.
Yeah. So so part of it is just like, it definitely demystifies it, just like takes the oomph out of it.
Right. I get it.
No, I get it. I have a question. So as you're doing these vaginal exams and these pregnancy high risk stuff, are they concerned of having like intercourse because they're pregnant?
Having sex during a pregnancy?
Yeah, because I see a lot of women that are like very concerned. Oh my God, doctor, can I have sex when I'm pregnant? Because some don't even want to touch their husbands.
Yes.
And they're like, please tell my husband that I cannot have sex when I'm pregnant. Please, doctor, please. Do they do that?
Why?
So first of all, yes. And they do sometimes.
Wow.
And I tell them, just hold on because your hormones surge throughout the pregnancy. And there's going to be a month where you're super horny and you're going to want to do it like breakfast, lunch, and dinner. Yes. So I'm like, yes. But just to be funny, sometimes I will write him a prescription because we don't use prescriptions anymore. Everything is electronic. So I'm like, no sex for the next month.
Yes.
Because she's my patient. She's my patient. I have to honor her wishes. But first of all, I guess I can't say no guy is that big, but there are some freaking humongous guys who can like rearrange your tonsils.
Oh my god!
So that's not good.
Wow.
But my running joke for patients is
for you.
No, for me to do that to a woman.
Did you hear that, Dr. P?
Yeah, I did.
Oh my god!
I think that's something else we have to dive into. Going back to proctologists.
Stop it! You guys are silly.
My running joke for patients is if sex during pregnancy was dangerous, I think the human race would be extinct.
Wow.
I really do. Because like everybody has sex during pregnancy. Come on.
Yeah.
I mean,
why wouldn't?
I mean, I think they say it's better to have sex, during pregnancy and then right before delivery because it helps open everything up, right? Is that true?
Not
Is that a
really.
myth?
Like all of those things are myths. Like there's nothing that's going to induce your labor. Like walking, castor oil, sex. I'm like, hey, you want to have sex? God bless. I'm not talking anybody out of it. But there's nothing that's going to make you go into labor. Labor happens for inexplicable reasons and it just happens. But in general, if you want to have sex during pregnancy, God bless. Enjoy it. My only recommendations are listen to your body. And if it doesn't feel right, and this goes for everything, exercise, activity, eating, if it doesn't feel right afterwards, you feel more pressure, cramping, anything like that, don't push it. Don't force it. Just let it go. The second recommendation is as you get further along, the positions have to change. You have to be cognizant of the belly. So, a
lot of them are doing it like doggy style, sideways. Whatever. Lift the leg.
Works. Yeah. Is that part of doggy style? Lift the leg over the heart.
It's like, you know how the dog pees? It's like lift the leg. It's easy to stick it in and go, it's like.
Whatever works. Yeah. It's all good. Yeah.
I'm just trying to pictures, it's just.
I mean, generally, missionary is not going to be a good idea when a woman is 9 months because it's
just bend her over.
Yeah, just bend her over.
Bend her over. Just have her just.
Let her.
Missionary would be kind of hard. It'd be like planking on a chick. You'd be planking like what's up?
Put a leg
it's just
up.
the logistics
teeter totter.
of it.
It'd be a teeter totter and shit.
Yeah,
whatever.
But sex during pregnancy is fantastic. Go for it. Do it. If a woman wants it, let her have it.
I had to ask you, I'm like, I know these women are just like, oh my God, doctor, please tell him I can't have sex. Because they do that.
Why though?
Because they're big. They feel, they don't, I'm sorry. When I was pregnant, I was like, oh my God, I'm fat. I feel like shit. I don't feel sexy. I just want to bust this baby out.
Right.
I'm swollen. I'm like leaking shit because you leak stuff that you don't want to leak.
There's more discharge.
There's more discharge. Yes. Like, it's just, your boobs are leaking. Like, everything's just wrong with you. And you're just like, get the fuck away from me. And sometimes, then you get your moods where you're horny. Like, you get all of these weird moods. So that's what I was asking.
And I hear that a lot. And, you know, it's like, I'm fat. I don't want to, and I tell everybody, like, you're not fat. You're pregnant. There's a world of difference between fat and pregnant.
Yes.
I mean, I honestly think overwhelming majority of pregnant women are sexy. You know, there is a glow to it. There is something about it,
right,
you know?
Right.
So it is very like internal, psychological. They feel like they're fat, but they're not. Let it go. Let your man,
you got a baby inside you,
his
not
thing.
fat.
Yeah.
We're doing something men can never do in their lives because God only created us to do it. And it's crazy because you're creating a human. It's like, it's, your body is in shock and it's creating this. It's just like, okay, you know, but we also, it's hard for us to do it, but we do it, you know?
I get it. And by the way, God bless women. I'll tell you a story. Like, first time I saw an actual delivery, I realized two things. Number one, God bless women, because
right.
Wow.
Yeah, I couldn't handle that.
Wow. I mean, you are pushing a cantaloupe through an opening that is designed to allow what? A peach through? Like, just the physics doesn't, like, I still don't understand how that works. And number two, I realized that whoever said birth is beautiful is very wrong.
You know what? I'm going to tell you something.
It is very, very
Looks like
gross.
a massacre, man.
I'm going to tell you something, Dr. P, regarding that beautiful of delivery. My father has 13 grandchildren, right? He never got to see any of us because, you know, back then they never, right?
In the waiting rooms, there's a cigar.
No. My son was the youngest before my niece years later, and I had him in my delivery room. And I said,
father?
Yeah. And him and my mother. And then as my son was, you know, I was pushing my son. I said, go ahead, Dad, go ahead and look. I let him look. He said it was the most beautiful delivery in the world that he said that was beautiful. He said, never did I see. And I let him see. I didn't care. Because it was a delivery. To me, it was having a baby. It wasn't about, oh my God, my dad's going to see me. I didn't care.
Right.
I said, go ahead.
It's not the same. It looks different from like the vagina in general. Like watching somebody give birth it's a very like,
I've seen it. It is almost like, I mean, this is going to sound weird. It's almost alien-like. You got this freaking thing coming out, like, the blood comes out, and there's like, what the fuck?
And by the way, poop comes out too.
Yeah.
If
Poop come out.
Thank the Lord I never did.
You guys be dropping bombs.
Your doctors didn't tell you.
No. I asked because I was
we don't tell patients.
No, I was so nervous, Dr. P.
We lie.
No, I was so mean.
We lie.
I mean, I was so nervous. I told my doctor, did I poop? Please tell me if I do. And I even asked the nurses there, no, you didn't. I said, okay. Because I wanted to know. I was so nervous about that.
Women poop?
Because you're pushing that's a
well,
pressure.
you're pushing. It's the same muscles. And,
of course.
As
like
you're
push,
taking a shit.
Yeah. And that's kind of how we guide them. It's like, just imagine that you're taking a big poop, the biggest poop of your life, a 7, 8, 9 pound poop.
Yes.
Imagine that pushing like 1 8-pound chunk out of your butt.
Yeah, that's
No.
Yeah. Dr. P, I asked, and I told them they needed to be honest, and they said they did not poop.
Well, I would say about 90% of the women poop, and we wipe it down. We just everybody like is on the same page. We ignore it. Nobody it's not. We don't make fun of it. We don't even talk about it afterwards. Is it like a big log? No, sometimes it's like pellets. Sometimes it's a log. And it's just like, you know what? It happens. There's nothing wrong. Have you ever got
like a log?
Yeah.
Oh.
Well, you just wipe it down and it's like, whatever. There is no shame in it. At that point, when that happens, you know a woman is doing the right thing. She's pushing the right way.
Yes.
And it's like, you don't want to embarrass her. You don't want to make her feel like aware of that or anxious. Or like, no.
Dr. P, you're too sweet of a doctor. Honest to God. I mean,
no,
that whole thing could be on.
What are you going to do? Like, haha, you shit. No, come on. That's just mean.
Hey, I was probably that doctor. Oh my gosh, you just took a big old dump.
Guess what? You just pooped. But is the baby out? Nope, just poop.
No,
I'd be
you
like,
should have
God damn, what you have for breakfast?
Big old log.
Oh,
Yeah.
jeez. That could be on an episode of Dirty Jobs. You guys should have an episode of
Oh,
Dirty
by the way, dude, just to connect these two and the squirting back, I do remember one delivery where the woman was pushing and pissed right over all my face. Like,
Damn, and you didn't have safety goggles on or nothing? It was just
I did not.
Jesus.
It was like one of those emergency deliveries where I think all the labor rooms were taken and we had to like rush her like from admission.
Was your mouth open? Dr. P,
I don't think so, but it's like it honestly like she was pushing and all the piss hit my face.
Jesus.
And I just like now I have a beard and I feel that shit dripping down.
Gosh.
And I'm like, well, I have two choices. I'm the only doctor in the room. I can say, well, fuck, this is disgusting. I can walk away and leave her to her own devices with a baby like halfway out.
gosh.
Or I can keep doing what I'm doing.
Yeah.
And I just stayed
Kept it
there.
professional.
And,
You're the sweetest
and
man.
I delivered that baby. And as soon as the baby was out, I'm like, I gotta leave. I gotta step out.
Did you
and I'm
disinfect your
like,
face?
this was in the operating room. So like outside, it was like the hardcore, like sterilizing shit that would
Look, he
kill
took one to
everything.
the chin and he kept it pushing.
I took one
good
in
job,
the mouth,
Dr.
in
P.
the
Good
nose,
job.
in
That's
the
professional. That is
eyes,
professional right there.
everything.
Yes.
Like piss was dripping down my beard, and that was not an enjoyable memory.
Good job.
Oh, there we go.
Good job, Dr. P.
Well,
Thank you.
good episode.
Leave you on a high note.
Yes. Yes. Anyway, well, Dr. P, it was an honor to have you here.
Oh, thank you so
on
much.
episode number
3.
3.
Yes.
And again, we want to have you back.
I would
Yeah,
love
we
to be
need
back.
to have you back so we can get some more. Because I know I have a
Yes.
feeling this episode, a lot of women and men are going to be like, "Oh man, this is a good episode."
Yes,
A lot
this
of-
is good.
Well, I feel like you have more questions.
Oh,
for
I
me
got tons of
because,
questions. We just ain't
I
got a
mean,
lot.
I established your baseline, which is like nothing.
Yes, King Cholo's
You
laughing.
are at
I'm
my
just trying to
kids'
improve my
level, and they're like preteens.
Yes.
You're at their level
No, I'm
of
just
trying to
sex
improve my-
education.
Doctor,
Yes.
I'm trying to
I
improve
feel like
my
I
game.
need to come back to educate
Yes,
you.
please,
Yes.
please do so. But we appreciate you coming down.
Thank you
and
so much. Yeah.
being here for our show. And again, thank you everybody for joining our Raw Opinions episode number 3.
Three. Thank you.
Thank you.
Appreciate it. Dr. P in the house.
Woo, thank you very much.